I, for one, never knew that this toilet infection is actually not gotten from the toilets. Hi guys, welcome to my YouTube channel. My name is Patrick. I'm a medical laboratory scientist and I talk about questions puzzling your mind about health. So if you're here, thank you for coming. If you're a returning subscriber, thank you. If you're new, thank you. So today we're talking about an interesting topic, toilet infection. I never knew that toilet infection was actually not gotten from the toilet. So toilet infection are actually infections that have unexplainable sources. And sometimes when you have an infection, because you can't explain the source of the infection, you just give it a name, something that you can just relate with, oh, probably he got it from the toilet. But are toilet infection actually real? Toilet infections are just distortion of the normal flora of the bacteria in your private areas, the urethra or the vagina. So it is a layman's word to explain vaginitis or urethritis. That means it is not a medical term. But how do people get this toilet infection? What kind of infections do they even talk about? There are two factors that could be responsible for this so-called toilet infection. Number one, sexual factors. Number two, non-sexual factors. So the non-sexual factors is what everybody doesn't know about. So the non-sexual factors is what I'll be explaining today. Sexual factors are caused by sexual activities and non-sexual factors are caused by different factors. There are many factors that can expose one to having these infections. Men are not exempted, but women are more prone to having these infections. Risk factors are hormonal changes. Women are more prone to having changes in their hormonal levels, especially when they are on menopause, pregnancy, or using birth control pills. Number two, when women douche, that means when you wash those areas with soap or using sprays or deodorant to take care of that area. It's kind of an hygiene, but dangerous for your vagina, Number three, using antibiotics when not recommended, both male and female. So you should use antibiotics when recommended and proper duration. Untreated infections, when you have an underlying infection and you don't treat it, probably you've ignored one infection before, you feel, oh, I'm fine now, I'm better now, that could lead to worse infections. And sometimes you'll be wondering, where did this come from? It came from an untreated infection, of course. Knowing these risk factors, can there be something I will do to prevent having this? Yes, of course. Number one, avoid douching. Take enough water. Avoid wearing tight fitted clothing. Avoid wearing damp undies. Avoid using antibiotics that are not prescribed. And when they are prescribed, avoid exceeding the range to which you should use it. So what are the symptoms? You'll probably notice that, oh, this looks like I'm having an infection, but I have not had sexual intercourse with anybody and I'm having these infections. The symptoms could be itching in that area, burning sensations, painful urination. When you urinate, you feel pains, bleeding or spotting. You're experiencing bleeding when you are not even on your menstrual cycle. And also awkward or odd discharge for male or female. So what do you do when you experience this symptom? Go see a doctor. You probably will do all these I've said to prevent, but when you notice that those symptoms persist, go see a doctor. And the doctor will probably review your medical history. He's going to ask you, have you had an infection in the past times? Have you treated it? What happened? What led to it? And after asking, or after reviewing your medical history, he's going to go ahead to ask you to do a pH test. That means he's going to check the pH of your vagina or your urethra. He's going to check the pH. The pH is usually between 3 and 5. It is usually acidic, but when it becomes alkaline, that means it's actually a breeding ground for bacteria and yeast infections. So after a pH test has been done, the doctor will not fully rely on that pH test. He's going to ask you to do a high vaginal swab or a urethral swab for male. So when your doctor asks you to do that, the medical laboratory is going to collect a sample from your vagina or your urethra. So in that case, you're going to provide that sample to the laboratory and 3 things are going to be done on that particular sample: microscopy, culture, and sensitivity. For sensitivity, which is the most important part, is that after the bacteria has grown, the medical laboratory scientist is going to tell you what drug will be suitable if there is any infection caused by a non-normal flora in your vagina. So that being said, if probably there was no infection, they could actually ask you to go ahead to do a pelvic scan to see what probably could be the other cause of this infection. Never leave a vaginal infection or any infection at all untreated. It could lead to infertility, or it could lead to you not being able to conceive. So I think we've successfully freed the toilet. There is no such thing as toilet infection. It's either a vaginitis, urethritis, sexually transmitted diseases, sexually transmitted infections, or bacterial vaginosis. So if you found this video helpful, do share it, give it a like, comment, subscribe. I'll see you in my next video. We now have a toilet infection. I just explained there is no such thing as toilet infection. What are you saying?